Dr. Jenny from China. She is the CEO of TDH Solution, member of the International Board of Advisors, KLAs. She is a medical doctor, obstetrician and gynecologist in China. She received a PhD in biomedical sciences in University of Sydney, and she has done a very, very innovative United Family Healthcare in China, which has set up 14 different units. She is going to talk to us about building internet hospital, and she has implemented it and she will share her experience. Over to you, Dr. Jenny.
Hi, everyone. This is Jenny Shao from TDH Solution Shanghai. So today it's my honor to be here to talking about the internet hospital in China. So the future of healthcare that we envision is only probably about 15 to 20 years off, but healthcare in 2040 will be a world very different from what we are having now. So based on emerging technology, we can be reasonably certain that the digital transformation will drive much of this change. And we believe care will be organized around the patient and consumer rather than around the institutions that are driving our existing healthcare systems. Healthcare system in China, the economy in China is developing fast. The people's living conditions are not at a corresponding level. A large gap exists between the development of economics and the people's well-being, including healthcare. Difficult access to medical services and expensive medical bills have been an issue of concerns in the country. The root cause of this problem is the lack of medical resources and uneven distribution of these resources. The population of the country is more than 1.3 billion, which accounts for more than 22% of the world's population. But healthcare investment only makes up a 4.5% of the world's total, and the medical staff represents only 13%. High quality medical resources are concentrated in large hospitals in the big cities. These hospitals are overcrowded, while primary medical institutions are lacking medical resources and are sparsely populated. So what is the internet hospital in China? Internet hospital is an innovation built on advanced technology, such as Internet of Things and the Internet of Medical Things. It is a combination of online and offline medical services. At early stage, online services mainly include booking, payment, release of results and report, consultation, chronic disease follow-up, and prescription. Offline services remain to cover lab tests, exams, surgical operations, inpatient admission, rehabilitation, special nursing care. Both online and offline services need a deep integration. For example, workflows, service integration, data and system interoperability to support patient-centric and continuity of care. So from a hospital perspective, this new internet hospital model is expected to resolve issues like absence in outpatient appointments, overcoming geographical constraints, delivering care closer home, and expanding the scope of hospital services. From patient perspective, internet hospital further improves accessibility and affordability. It is considered as a product or a service to solve medical resource issue partially. So by January 2019, the number of registered internet hospitals had increased to 300 in 25 provinces. The sponsors are government, hospitals, enterprises with different supporting content and responsibilities. As a new service model, internet hospital is distinct, but a bit overlap with online health, telemedicine, and mobile medical. Now, Internet of Things, Internet of Medical Things are changing the face of healthcare and health management. it has shown promise for improving accuracy of current processes. Internet of Medical Things is expected to increase by 20% in 2020. The expected market size is above 500 billion US dollars in 2025. The expected global saving is over 60 billion US dollars in 2022. A Gartner survey of 500 US-based enterprise IT managers showed 86% of managers in healthcare reported having an IT, Internet of Things, architecture in place for most lines of business. It is also interesting that less than 50% of medical doctors believe that Internet of Medical Things are reliable. So for future hospitals, future healthcare, and future patients, the biggest shift will be consumer-centric health. The acute care hospital will no longer serve as the center of the gravity. Instead, the center of gravity in future will be consumers. The organizations will provide the structures that supports the new consumer center. Virtual communities, including virtual healthcare providers and enablers and wellness coaches, probably will play a significant role. And these communities could be defined by geography, or they might be communities made up of people with a certain health condition. They could also be comprised of a patient, family members, and supporters. And a specialty hospital and a community hospital will be the two main types in the next 20 years. We will still need specialty care providers and highly specialized facilities for patient care. And the data-driven personalized care and health plans, and the increased focus on prevention and early intervention, combined with advances in biosensors and the digital technology, can create new opportunities for medical technology companies. Health plans will likely develop a new business model that focuses on well-being. We expect health plans to become a data convener, service sciences and insight engines, data and platform infrastructure builders. So using the wealth of data, health plans could develop new revenue streams based on consumer insights, population health initiatives, and customized offerings. The stakeholders should also appear to nearly empower the health consumer, develop strategies to engage effectively with consumers, work to earn their trust and demonstrate value. Consumer attitudes and behaviors will certainly change in the future of health. Interoperable data, machine and deep learning capabilities, always-on biosensors, and the behavioral research will enable personalized and real-time AI-driven behavior intervention that shape consumer beliefs and actions. And the patient consumer will receive care wherever they are, and they will be exposed to digitalized well-being. They will be empowered by health education knowledge, as well as powerful access to accurate and multi-dimensional personal health data. They will be in much better position to participate in own care, make a shared decision for themselves, for family members as well. So the challenges and opportunities, challenges, including, so for example, how to incorporate online medical services into healthcare insurance program, and the quality control, and how to ensure online diagnosis and treatment are safe, and how to find opportunities in training and education and disease management as well. And finance-wise, what is the long-term return on investment? And of course, privacy, user safety, and the data safety is always the biggest concern and need to be figured out how to cope with it. Now, if we're looking at the opportunities, we can see mobile phones users in China is over 1.3 billion. This is 2016 data. And the 4G mobile internet users are over 58%. And the EMR digital hospitals are popular. Over 90% of tertiary teaching hospitals are having EMR in place. Telemedicine, collaborative medical care, and cloud tech, big data, wearable devices are booming in China, and the mobile internet technology as well. And also regulation and public policies are maturing at the same time. So in conclusion, internet hospital are booming in China. The rapid expansion suggests a direction for future healthcare. At exploring stage, it is the joint effort of the government and the market to overcome shortages of medical resources. Internet of Things, Internet of Medical Things is a key technology supporting mobile internet and the mobile medical care. And of course, certain standards and the standardized process are required to meeting various needs from stakeholders. All right, thank you very much for your patience.
Has there been any impact on patient-doctor relationship and patient satisfaction in internet hospitals compared to physical hospitals?
Certainly having impact on this internet hospital and internet medical care. And the patient is changing their behavior because they start used to mobile phones and they start to use all different technology to reach hospital and reach doctor's assistant as well as doctor self. And the patient relationship with doctor are changing. And instead of before they have to, try to push to the hospital and getting all the, quick consultation in 5 minutes. Nowadays, they have more different access to access their medical services. So of course, the relationship is changing and the patient is getting more powerful and they are empowered and much more engaged as well inspired by the technology.
Thank you.